So another question that can be discussed in this case presentation, is the importance of the response to the salvage therapy that can be assessed in different ways. We decided to use FDG-PET scan to assess this kind of response. In the past, we had only the CT scan that was available to assess the results of the initial phase of salvage therapy. With the use of FDG-PET scan, we realized that the achievement of a negative PET scan has a high predictive power to try to foresee the final results and the final result and the outcome of the patient. That is, the patient with the residual positive PET scan before high-dose therapy tend to have a poorer outcome, and in this patient the efficacy of the high-dose therapy is lower. Luckily, in our patient, we had PET scan after cycle 2 and cycle 4 of the IGEV chemotherapy, and also starting from cycle 2, we achieved a complete response. That is the disappearance of all the hypermetabolic sites of disease assessed with the FDG-PET scan. Based on this initial observation, that is the higher risk of progression and of treatment failure in patients that go to transplant with a residual positive PET scan after reinduction therapy, it is becoming more and more important today to reach the complete remission before the start of the high-dose chemotherapy program. In case of residual sites of disease, then there is a strong rationale to even postpone the start of the high-dose chemotherapy program, and before completing the treatment with this final therapy, to try to use alternate chemotherapy program to try to achieve the complete remission in the patient. In this setting, the new drugs can be used and can be investigated to see if they are able to increase the rate of complete remission to the salvage therapy program. In particular, this new drug that is brentuximab vedotin, that is currently registered as monotherapy for the treatment of relapsed refractory Hodgkin lymphoma after high-dose chemotherapy, or who are not candidate for high-dose chemotherapy. And this drug should be and is currently investigated as a part of the reinduction program for the initial salvage therapy in patients relapsing or progressing after first-line chemotherapy, actually to try to improve the anti-lymphoma activity of the salvage therapy program and to increase the rate of PET negative patients that can be then addressed to high-dose therapy with a higher chance of being cured for their disease.